Really pleased to be here to talk to you on day 2. And for me, one of the really big learnings that I took away from yesterday was around the direct relationship that we heard about through Caring Together of leadership and leadership training and actually getting results. And that's actually going to be quite a big theme in what I want to talk to you about today. And I want to start by saying that I stand here with great humility to talk about my leadership journey and what I learned through the HIV/AIDS epidemic. And I say that because I think I met more really inspirational and great leaders during my time working in the AIDS response, which was around 11 or 12 years directly, than at any other time in my career. And I also say it with humility because I'm very aware that many of you in the room have shared that leadership journey around HIV/AIDS here in Uganda, and that there are many leaders from the epidemic here. People like Dr. Ade, people like Dr. Alex, who we heard from yesterday, and many others. But what I want to try and draw on is, from my perspective and from the perspective of leadership positions in international organizations, what can we learn as leaders from the response to the AIDS epidemic? And the first question is, why choose that? When I was asked to speak, why choose the HIV/AIDS epidemic? And I choose it quite simply because it's one of the greatest health challenges I think globally the world has ever faced. A disease that tracks stigma, that tracks injustice, that tracks poverty, a disease that forces us all to look at things that were really, really hard to look at, a disease that threatened global security. All of those things means that it was one of, I think, the greatest leadership challenges globally that we've ever seen in global health around the world. And secondly, if we look at what's been achieved in actually fighting that epidemic, it's truly remarkable. And even though we all know that that battle is absolutely not over, if we think that, for example, in the year 2000, there were 700,000 people globally on ARVs. In 2017, that figure is over 20 million. That is remarkable, absolutely remarkable. During the same time, the number of new infections has declined by 35%. And in the year 2000, the cost of an annual ARV treatment was over $10,000. By 2011, that had been reduced to under $100. And we stand now at a place where we can actually talk about the elimination of HIV/AIDS, the ending of HIV/AIDS by 2030. And of course, that's not something that will be easy, but it's something I could never imagine back in 2004. And when I reflect on the why, what has been critical in the success around this battle, I think it absolutely comes down to leadership. And it comes down to leadership that has happened at all levels of the epidemic. And of course, Africa has been at the front line of that right from the very, very beginning, and has shown leadership at the national level, the continental level, and of course here in Uganda, where you have, as many of you in the room have lived, your story of reducing a prevalence from around 35% back in the 80s down to around 6.5%. And I want to go back to this theme that has been through the conference today of leadership at all levels, because it's that leadership at all levels that I think we see in the response to the HIV/AIDS epidemic above all. So first of all, obviously it's very easy, I think, for many of us to think about leadership at the political level, particularly internationally when we think of the AIDS epidemic. There are so many great leaders, so many great visionary leaders, people like Kofi Annan, who conceived of the Global Fund and then persuaded the G8 to put the money behind it. People like President Museveni here, who acknowledged HIV/AIDS so early on and was so instrumental in the response in Uganda that led to the reduction in prevalence rates. People like Festus Mogae in Botswana, who had the commitment to ARVs when everyone said it's impossible for you to roll out ARV treatment in Botswana now. But he did it because he had the vision for that to happen. However, we need to also remember that at the beginning of the epidemic, back in the 1980s, there was no political leadership. Absolutely nobody was interested, and people began to die in their thousands, and very little was happening. And it was actually the leadership from AIDS activists, and as Dr. Alex referred to yesterday, people living with HIV who moved into that leadership vacuum. And one of the things Alex said yesterday was, you really notice leadership when it's not there. I would also say that if leadership is not there, it creates a vacuum that someone will move into. And people living with HIV/AIDS moved into that. Activists in the US who pushed so hard for drug companies to take notice, for the science to happen, to develop the drugs that they needed, to actually get the political response and the resources that were needed to make a difference. And of course, that activism was part of the story in Africa as well, with the foundation of organizations like TASO and the Treatment Action Coalition in South Africa. And certainly, when I reflect on my leadership journey at the HIV/AIDS Alliance, the leaders that I met who were most inspirational were those people at the community level, were people living with HIV/AIDS who had the courage to speak about their status, who were able, even though they were sick, to lead their communities. They were activists and advocates in civil society who were relentlessly holding governments to account. And they were scientists who had a vision about how to treat and deal with this disease. And honestly, the HIV virus is one of the most complex and challenging scientific problems that there is out there, but there's a relentless drive to get to solutions. And many of the volunteers that I met that were willing to put themselves on clinical trials to try and find an AIDS vaccine. All of those people have been so important in the leadership response and in the success. And that is the key lesson for me. And it totally echoes what we heard yesterday from Caring Together, that leaders are everywhere. Leaders are at all levels. We are all leaders. And those leaders are absolutely necessary at all levels to get results. That's the first lesson. The second lesson I want to draw is about leadership skills. And because this conference is so seamless, again, I'm going to echo some of the things that your group, actually, the group that was talking about leadership, came up with yesterday. And my second learning, when I look at leadership across the HIV/AIDS epidemic, is that leaders everywhere in organizations, it doesn't matter what level they're at or what they're doing, good leaders share certain skills and certain qualities. And there was some interesting research that I found in the Harvard Business Review that actually echoed that surveyed over 300,000 people at different levels of an organization. And what they found was that it didn't matter where those leaders were, there were 4 key traits that they all shared that made them successful. And I want to share those 4 key traits with you of good leaders. And you heard a lot about them already, so it's not going to surprise you, but this is just reaffirming. First of all, they have the ability to inspire, the ability to motivate, and they create a vision and they bring people with them. And when you think about the AIDS response and some of the leaders that I've talked about already, that is exactly what they've done. And, you know, setting international targets like the Millennium Development Goals, like 1990, and then inspiring people nationally and global through all sorts of cumbersome bodies, right down to the community level to drive for results, has been a huge success in the AIDS epidemic. But when I was thinking about this from my own leadership journey, it was actually a very different example that came into my head, and it was from when I was working at the International AIDS Vaccine Initiative, and one of my jobs at that time was to go around governments all over the globe, really, and try and persuade them that they should invest in the science and the research and development to get an AIDS vaccine. And the conversation would go marvelously to start with. I'd talk about the fascinating science that was happening and how, you know, only a vaccine would have the ability to actually get to zero. This is the way that governments could end the AIDS epidemic. And then their first question, they would say, "This is really, really interesting, Jane, but how long is that going to take?" And I'd say 20 years. And that was kind of, you know, a real problem in the conversation. And after I'd been doing this for a few months, I went back to the organization feeling a little shaken by the conversations I was having and thinking, is this really possible? And I think, you know, my own motivation was beginning to flag. And I went to talk to the vice president that led discovery in the organization, and I shared this with him. And I said, please tell me that you're going to get this AIDS vaccine, because frankly, the results I'm seeing so far are really depressing. It was just dawning on me how hard this actually was as a scientific challenge. And he looked at me and he just said, yes, Jane, of course we're going to get an AIDS vaccine. I said, well, how? How on earth do you know that? And he said to me, because I believe in science. And I found that incredibly inspiring and incredibly motivating because it made me realize that this was, again, about a vision. It was clearly a vision and that many people were working towards that vision with absolute belief. And it was something that I could then translate when I was talking to others. So that's the first thing, vision, motivating others. Second, good leaders, and we've heard this a lot already with the group presentations, they have honesty, transparency, and integrity. And if we think about so many of the activists working in the AIDS epidemic and their courage and openness to speak out, I think we've seen that a lot. And one of the people that I think about when I think about integrity in the leadership of the AIDS response is Zaki Ahmed in South Africa, who, of course, led the Treatment Action Coalition, was diagnosed with HIV in 1998 and refused to take treatment, even though he could have done, until it was available to everyone in South Africa. I found that one of the most inspiring stories that I've heard. Thirdly, good leaders have the ability to solve problems and the ability to analyze issues. And again, that takes me back to the activists at the beginning of the epidemic in the 1980s who were not scientists at all, but who made themselves scientists in order to try and understand what they needed to say to the drug companies to get the treatment that they needed. And they were so instrumental in driving forward an agenda, as I said at the beginning, when there was no political leadership. Fourthly, and probably not surprisingly, good leaders always drive for results. They push for results at all times. And again, if you think about the international targets I mentioned, the drive that there's been at international, at national level, but also down at the community level and from civil society advocates that has gone on over the whole of the response to the epidemic to constantly push for the resources that are needed, to constantly push for the science that is needed, to constantly push for the leadership is needed and the access to treatment and prevention has been quite remarkable in the HIV/AIDS response. So those are the four things that I wanted to bring out that all good leaders have, and I think they echo quite nicely some of the things that we've heard already. And they're certainly echoed a lot in what we heard yesterday around caring together. But I also want to suggest that great leaders share three further things. And I'm going to call them the 3 C's because it's nice to have some threes. So the first C is courage. And courage is something that I've already mentioned that I think I saw over and over again. Particularly I saw it at the community level. People who were willing to talk openly about their status, even though there was huge stigma and discrimination in doing so. And I think that has been a hallmark of much of the leadership in the HIV/AIDS response. Second C, great leaders have compassion. Compassion that has the ability to combat and to fight stigma and discrimination. Compassion that health workers at the front lines, health facility workers, seeing patients day after day after day and holding that compassion central, as Dr. Alex talked about yesterday, that patient relationship, which has been absolutely central in the HIV/AIDS response and has also changed, I think, health responses beyond HIV/AIDS. And the third C, I could probably ask you to guess what this is actually. The third C is probably not surprisingly communication. And within that, what I want to talk about finally, and what I want you to take away as a key message, I think, is listening. The importance of listening to be a great leader. And I say this because I think when I think about my leadership journey, it's actually been my greatest learning. I recently started training to be a coach. And on the first day of the training, I was sitting with lots and lots of really experienced coaches, and everyone was going around talking about all their coaching experience. And I was like, oh my God, I haven't really got any coaching experience. And I said, well, I don't really have any coaching experience, but I have many, many years of leadership experience. And I've always taken a coaching approach. Well, that sounds good. I've always taken a coaching approach to my management. Well, by the end of day one, I knew that that was total rubbish. And I knew absolutely nothing. I was in a state of what they call complete unconscious incompetence. Because in fact, when I was listening to people, I had something in my head all the time going, I know what you need to do. I know what the solution to this is, because that's what I thought my job was. I'm a leader. I have to come up with solutions. And then I would direct them gracefully in some way towards the solution I thought was the best solution. I thought this was coaching. No. What I've seen through my coaching training and more recently through that work and my leadership work is the power of active listening, the power of really staying with the not knowing, of really asking open questions, of really having curiosity, because, and I've really come to believe this because I've seen it, very often the person holding the problem also holds the solution. And it's only by listening that we can ignite those solutions. And I also saw that in the response to the HIV/AIDS epidemic. I think we saw it through Caring Together, when yesterday we talked about communication skills being so important in negotiation, in conflict resolution, in teamwork, in management. And it's backed up, interestingly, by research. For example, research has found that in negotiation, listening is 4 times more important for success than anything else. It's been found in management research, where if you're dealing with a really challenging change process in an organization, you need to tell people between 7 and 21 times the message you want them to hear, because it's so hard for them to listen. So listening is incredibly important. And as I say, it was incredibly important for me in the HIV/AIDS response at the International HIV/AIDS Alliance. We were all about listening to communities and understanding what communities saw as the solutions to the challenges they were facing. And the initiatives we were designed were based on that listening. And we then found that when they were actually evaluated, that they were much more effective than many interventions that have been done with a top-down approach. So that's the message that I really want to leave you with, because it's something that, above all, I feel that I have learnt. And that is, that as great leaders, and I do believe we're all leaders in this room, that as great leaders, what we really need to do is to listen more. Thank you for listening to me.